on. Hey, you guys had shirts on when you came in here.
Something happened to him, man.
You see that sign?
No shirt, no shoes, no dice.
Right. Learn it. Know it. Live it.
Well,
Stay tuned for tonight's adventure with the Fat Man.
Okay, here we go. Good morning, good afternoon, good evening, whatever time of day it is. I hope it's good to be where you are because I'm really excited to be here today. My name is Baltimore Fats, and this is Unmasked. Yeah. Okay. All right, so we're going to talk a little bit about masks. It's been such a hot topic, and there are lots of great videos out there about masks. So, but there's something that's been bothering about masks pretty much since this whole mask culture started. And that was I was expecting to see a rise in fungal lung infections from wearing these masks, especially the way that I see people wearing them. And it's become more apparent to me as the push for more mask wearing and, Trump coming out in support of masks and things like this, how unhealthy it seems to me. And so I can't speak for anybody about masks or whether to wear them, not to wear them, whether they're healthy, unhealthy, what good they do. I'm not here for that, right? I'm just here to inform myself, and make the best decisions that I can make and think as freely as I can about this stuff, and right. And so one thing that I have been anticipating is a rise in fungal lung infections because I know where mold lives, right? Mold thrives in damp, humid, and wet conditions. Just like the conditions we create for it, just like the conditions we create by wearing our masks. Especially, as I was saying, the way people are wearing them today. Like, this week in Baltimore, it's been 95 degrees more, 100-some degrees, right? 1,000% humidity. And I've seen people jogging in these things, right? Riding their bikes in these things. Sanitation is a huge thing. Of course, it's a big part of the COVID as well, hygiene and everything, and so now when it's coming to these extreme conditions, how well are people actually taking care of their masks? What harm could they be doing by breathing in this mold? Because mold is a human allergen, right? And, so like I said, I've been waiting, right? And then, it's the summertime, so I haven't been paying quite as close attention as I normally might, and I kind of missed this, but earlier this month, PolitiFact, quote-unquote, debunked this Facebook meme that stated, people are starting to enter ERs with fungal lung infections from wearing masks, right? And their PolitiFact truthometer went, hey, that's false, right? But it's PolitiFact, the Pointer Institute, like they're pointing the facts to you. Again, now, I'm really kind of interested in this because, like I said, I can't speak for anyone else, but when I wear my mask, I immediately feel like claustrophobic in it, and I feel a difficulty breathing. It fogs up my glasses, which of course obscures my vision even further. I feel very uncomfortable, and I trust my intuition in this, in that it feels unhealthy when I wear it for too long. And so that's why it's kind of surprising that that there hasn't been a rise in fungal lung infections, according to PolitiFact. All right, so you know how PolitiFact works, and right, is mask wearing causing fungal lung infections? No, this is another bogus claim on Facebook, right? And so they kind of break it down quickly here. But what I really want to do is even not so much focus on what they have in here, but where are they getting their information from? I want to fact check the fact checkers. Right? I'm going to watch the Watchmen for a minute here. Right? And so they start off by talking about the Facebook meme, right, that was shared 16,000 times and viewed by almost 700,000 people in its first 24 hours. But they took it down, of course, because, Facebook, right, and fake news and stuff, right, and they deemed it false, right, this fact checking, right? And so the first thing that they do in their article is to debunk a claim is to use themselves as a reference, which does not start them off on a very good note for me. It's not being very fair and unbiased, to use yourself as your very first reference, right? And then the fact that they do it again, right? And this is in talking about they're investigating claims that it decreases oxygen and breathing in your CO2 is not good, and those claims, right? And I'm sure they use some of these similar sources that we're about to discuss. All right, so this is where we get into the fungal infections, right? And like I said, I've been anticipating an increase. And before we really kind of talk about this, I do want to look at what fungal infections are, all right? And so, fungal lung infection, all right? And that's called Aspergillosis, all right? And it's an infection of the lungs, right, where a ball of fungus fibers, blood clots, and white blood cells may form. Ugh. That doesn't sound so good. And patients may cough up blood or have fever, chest pain, difficulty breathing, right? And so I didn't want to use the CDC because I did use them for something later, which is just absolutely unbelievable, right? But I will use the Mayo Clinic here for Aspergillosis, right? So they talk about that it's a type of mold, right? And the illnesses resulting from Aspergillosis infection usually affect the respiratory system, but their signs of severity vary greatly, just like something else, right? And so the mold that triggers the illnesses, right, Aspergillus, is everywhere. It's indoors and outdoors. It is unavoidable, right? And so when you talk about growing mold on your mask, if these Aspergillus spores are everywhere, they're getting on the masks. And if people aren't being diligent with cleaning their masks, and this is the one thing I want to keep in mind, is that especially like here in Baltimore, some of the most at-risk people, these poor people, these homeless people, they don't have the luxury of paper masks, disposable masks, washing machines, and things like that. And I see them hanging out downtown on bus stops and park benches and stoops and things like this. They all have the same mask, and these things are filthy, right? And so it's really kind of unavoidable, right? But it says that most strains of this mold are harmless, but a few can cause serious illness when people with weakened immune systems, underlying lung disease, or asthma inhale their fungal spores. And now again, a very interesting correlation to COVID and that it attacks, that it's more severe in people with weakened immune system and underlying lung disease, being a respiratory infection, right? And asthma too, right? And some people, the spores trigger an allergic reaction, right? And so the thing about Aspergillus is it's really, in its most severe forms, it's really not all that common. And in America, roughly 4,000 to 6,000 people a year die from it, right? But that's not nothing, right? If every life matters, right? That's not nothing. But it is interesting to make these correlations with mold and the possibility of them growing on masks and, the ill health effects that could have. What they say they do is that they consult regional, statewide, and national experts, right? And so in terms of these fungal infections, the first expert they reach out to is one from UC Davis in Sacramento. And I assume that he's the regional expert, right? And he says that, they haven't heard of it, right? Nope, it's not coming their way. And they also consult this person who's the executive director of the California chapter of the American College of Emergency Physicians. And she called it, as suspected, false. And she hasn't heard anything. All right. And then finally, they use the National American College of Emergency Physicians. And then when I read that, it really kind of threw up a flag for me because it's like, wait a minute, isn't this really kind of like using the same source? Especially when all of these quotes are coming from emailed interviews. I think that shows lazy journalistic integrity, right, if you ask me, and does not really give me much confidence in PolitiFact here. Right? Because when I look up the American College of Emergency Physicians, and I look for their campuses and whatnot, their main base is, their national headquarters is in Texas, right? But their chapters, we'll go to California, the chapters in Sacramento. So to say that you're using regional and then state, but then have your state come from the same region, I don't know, it's a little disingenuous to me. I don't like that, especially if you're trying to debunk a claim, right? You should be a little more thorough. And this person, a spokesperson for the ACEP, the American College of Emergency Physicians, right, wrote that they've heard folks complain about irritation, but they haven't heard reports of fungal infections, right? And that there are several professions where people wear masks for hours on end, and I think it's, several, I think, couldn't you use something better, like many even, and several is kind of specific, to 7. And again, these professional people who have to wear masks have the luxury of, disposable masks. They don't have to wear the same mask all the time. And furthering their debunking, they continue to use the American College of Emergency Physicians. They talk about how people on the Facebook post, some worried about the health effects, but others were skeptical because doctors, nurses, and mechanics, and others who wear masks for a prolonged period, they don't come down with fungal lung infections. And why is that? Because doctors, nurses, mechanics, they have disposable masks. They're not wearing the same thing all the time, right? And one medical professional jumped into the fray with her own comment. "It isn't happening. I'm an ER nurse. This is not true at all." Well, what medical professional does that? None, So the next one for sanitary tips for mask wearing, the next resource that they use is this Medical News Today, right? And they fact check. There's no evidence indicating that masks increase wearers' risk of developing pneumonia or other bacterial, viral, or fungal lung infections. All right, so let's find out what Medical News Today is. All right, here we go. It's a web page, that's pimping medical advice. All right, in this article, COVID-19 and face masks to wear or not to wear. It was written by this PhD here. Let's see what she's all about real quick. All right, she has a bachelor's of science in biochemistry from where? From King's College. Get out of here. All right, it doesn't say if she's like staff for Medical News Today or if this is just a sourced out article. But what I wanted to find out was, well, okay, so who owns Medical News Today? Why are they a reliable source of information? All right, and they're part of this Healthline Media UK or Red Ventures Company. All right, so I looked up Red Ventures Company. And so what Red Ventures Company is, of course, is just another PR firm. All right, we are Red Ventures. It's a portfolio of digital companies that brings consumers and brands together through powerful, customized online experiences. Now, I don't know how many times I've seen this during this COVID pandemic and me looking into it. These medical web pages offering advice or whatnot, their source always leads back to these PR companies, right? They solve complex problems across a variety of industries. A complex problem is, these people, they're really not taken to wearing the mask. They don't like it. It doesn't make them feel good or anything like that. And so we need to come up with something. Well, Red Venture says, "Hey, don't worry, we got you covered. Have we got the webpage for you?" It's Medical News Today. They're right under their wing. And we got doctors under our wing too. And what these doctors are going to do is they're not going to do anything more than, at best, parrot the information of the CDC and the WHO. At worst, parrot the information that you want them to parrot for us. Just tell us what you want them to say, and then that's what they'll say for you. And so the next source that they use is the World Health Organization. And they acknowledge that if a person wears the same mask for a long time, microorganisms may grow. Microorganisms like mold, right? Like Aspergillosis. The World Health Organization paper that they use in their fact-checking here actually turns out to bite them in the butt quite a bit if you actually just go in and look at it yourself. All right, so this is interim guidance published on June 5th, 2020. It's the most recent update from the World Health Organization. I'm sure they're going to come out with one soon, the way they've been pumping the mask agenda and everything, right? But essentially what they talk about is the use of mask as a comprehensive package for prevention and control measures, right? But it does say that, however, the use of a mask alone is insufficient to provide an adequate level of protection or source control. Using a mask doesn't really do all that much. It's only perhaps in conjunction with these other elements, social distancing and quarantine. Right, but the document provides information, guidance on the use of masks in healthcare settings and for the general public. What I want to show is what they say here is that the current evidence suggests that most COVID transmission of COVID-19 is occurring from symptomatic people to others in close contact. Most transmission. That doesn't say all transmission, of course, but most. And the studies that investigate transmission should be interpreted bearing in mind the context in which they occurred, which is something that they do a little bit in this report, but is not something that's a part of the mainstream media process of propaganda and paranoia and fear-mongering, right? Not at all. Right? So they also talk about the possibility of transmission from pre-symptomatic people who have it but have yet to show sign, but also asymptomatic people, those who have no symptoms at all. Right? And they say that one recent review found that the proportion of asymptomatic cases ranged from 6% to 61%. I mean, what kind of margin of error is that? with a pooled estimate of 16%. So 16% of COVID is asymptomatic. Right? But it does say that most studies included in this review have important limitations of poor reporting. So it could be considerably less. It could be more, of course, but it could be less. They say here that comprehensive studies on transmission from asymptomatic individuals are difficult to conduct, but available evidence from contact tracing reported by member states suggests that asymptomatically infected individuals are much less likely to transmit the virus than those who develop symptoms. With an open mind to everything, what this is saying is that it is not likely that unless you sneeze on somebody directly, unless you have no self-control over yourself, you're not going to shed this thing on somebody if you don't show the symptoms, and that it's only if you're symptomatic that you present a higher risk, and not 100% risk, by the way, just a higher risk of shedding the virus, right? Because they show here that they had 63 asymptomatically infected individuals studied in China. There was evidence that 9 or 14% infected another person. But that just says evidence. Evidence is not proof. There could also be evidence to suggest that these 9 people came in contact with people who were either pre-symptomatic or symptomatic as well. There were 2 studies, and one found no secondary transmission among 91 contacts of 9 asymptomatic people. So a very small sampling to be sure, but 9 people over 91 is an average of, 10 people a contact with no transmission, right? And I do like the footnote there is 33, right? No coincidence, right? While the other reported 6.5% of cases were attributable to pre-symptomatic submission. So again, even cutting this number of 9. Really the language of the article, in seeing the whom COVID affects the most, it just seems like a lot of common sense would go a long way to curbing COVID over, these, to the quarantining and social distancing, which only serves to weaken our immune systems just by virtue of distance alone. We need to be around people. We are social animals, right? And so for the evidence, for what they give you, for who should be wearing masks and stuff, and again, this is just in June, all right, their recommendations. All right, these are for healthcare workers. All right, and again, I'm going to try to provide a link to this article. All right, but healthcare workers for home visits, when in direct contact, they should consider using a mask. You don't have to; it's not necessary. Healthcare workers and certain community outreach programs should consider. But also, there are healthcare workers and community outreach programs that there's no mask needed at all, and some other healthcare workers, of course, need medical masks and 95 and 99 masks and so forth, right? But when it gets to the general public and what they recommend for the general public, right out of the WHO, right, non-medical masks for potential benefit. Right? There's also potentially no benefit whatsoever, but for the potential benefit, a non-medical mask, right? Public settings, work, gatherings, things like this. Really, they don't do much, and certainly in this article, to really hype up the dangers of not wearing a mask by any stretch of the imagination. Potential benefit, This one is for protection and source control, but, again, this is people with active symptoms, not asymptomatic people or people with no symptoms, right? And this is protection for those of age and of risk groups. And the last source for their fact check, right, is the CDC, and the article that they use here is for how to wear one. So it's not really even about whether or not there is any clinical evidence to suggest that masks may cause fungal lung infections or not, right? It's about the proper wearing of one. And it says who should wear them by they say who should not wear them, which is children under 2 or anyone who has trouble breathing, unconscious, incapacitated, or otherwise unable to remove a mask without assistance, right? And that surgical masks and respirators should be used for healthcare workers and first responders only. So cloth masks, right, for anyone over the age of 2 in all public places. It just talks about how to wear it, and not that there's any sort of evidence backing a claim that the masks are not causing fungal lung infections. Because somewhere else in the CDC gives us much more useful information in fact-checking whether masks could be causing fungal lung infections. I don't see how PolitiFact or any other organization claiming to debunk this, people are starting to enter ERs with fungal lung infections from wearing masks, right, can do so when they take this into consideration. And that's what the CDC says about Aspergillosis statistics, right? How common is aspergillosis? Because aspergillosis is not a reportable infection in the United States. The exact number of cases is difficult to determine. Now I'm going to read that again, right? Because aspergillosis is not a reportable infection in the United States, the numbers are difficult to determine. Not reportable. So how is it that you're not finding any evidence of lung infections from wearing masks? Is it because doctors are not required to report lung infections? Or certain ones anyway. And aspergillosis, right here, CDC says it's not reportable. You don't have to. So amidst all of this, and with aspergillosis having as many common symptoms with COVID, and it affecting the same target sort of at-risk communities in a very similar way, it seems very interesting that it doesn't need to be reported. So you didn't fact check anything here. Right? At all, right? There is no evidence. These people could be having fungal lung infections, because let's talk about what else is a lung infection. And they mention it here in this article about aspergillosis, right? And that's that it affects most the weakened immune system's underlying lung disease or asthma. And so now for asthma, right, causes of asthma, they don't really know what causes asthma. And so now they don't really know what causes asthma. Right? There could be a genetic component. It's passed down from generation to generation. But in all likelihood, it is mostly due to allergies and is allergic reactions to things. Right? And one of the markers for asthma, of course, with all other allergens, is mold. Right? And as I'm saying that, more and more people wearing these masks, especially in poor socioeconomic conditions, children, these runners, these idiot bike riders and runners, doing it in 100-degree heat with 1,000% humidity. They're just breathing in mold, whether it's aspergillosis or some other type of mold. Right? So I would expect to see asthma cases on the rise here too, but perhaps maybe low-level asthma cases are not reportable, just as aspergillosis is not reportable. So that would also tend to skew the figure of people who are coming in suffering from asthma, maybe who didn't have asthma before. Or had more latent asthma that was been aggravated by wearing these masks. If they don't have to report fungal lung infections, you can't debunk these claims. Because one of the things that they use, one of the terms that they use, I think, in this article here is there is no credible data. So what is credible data? Credible data is like your research papers. But most of these research papers come from these self-serving organizations like the CDC or pharmaceutical companies or universities, and the presence of publication bias can never be understated. This data can be bought and put out and filtered through public relations firms like Red Ventures. Maybe asthma is one of these, right? And let's find out some facts about asthma here. And it says that 25 million Americans have asthma, almost 8% of adults, and 8.5% of children. That's unbelievable, right? Asthma is more common in women than in men, but African Americans in the U.S. die at a higher rate from asthma than people of other races. Asthma is the leading chronic disease in children. And now this is going to be an interesting thing with schools opening up and then making children over 2 wear masks out in public. And the beautiful thing about children is their immune systems are so strong because they keep putting things in their mouth. That's all they do is put stuff in their mouth. Right? And I don't know, maybe the writers of these guidelines haven't tried to keep a mask on a 3-year-old or a 4-year-old. And what about special needs children? People on the spectrum or with autism, who have issues with things on, being touched and things like this. This can be a big, big problem. So I just think it's amazing that with mold growing on these masks and the potential for people not to take care of their masks and the overuse of masks could lead to the inhalation of mold. And mold can create allergic reactions, which can lead to asthma and aspergillosis, and that they're not required to report this. That's rigging the game in terms of health effects here. And I think I got to everybody there, but one thing that really kind of kicked this off and made me really want to do an episode was a recent episode that Miss Havisham put out. I think this is her most recent one, and I'll try to link it. And about the 4-minute mark, she reads this headstone here, and it chronicles this guy's passing due to consumption, which is tuberculosis. Right? So I wanted to look up tuberculosis a little bit, right? Because while having all of these mask things and this cancel culture, virtue signaling, Karen inciting, mask wearing. I don't know what to call it going on, I mean, other respiratory illnesses that are much more severe and spread in a very similar fashion to COVID are out there, right? And so looking at tuberculosis, right? Tuberculosis, a total of 1.5 million people die from tuberculosis in 2018. So we'll average that out to 1.5 million a year die from that, right? It is the top 10 cause of death, and the leading cause from a single infectious agent, right? 10 million people get it a year, right? But the thing about TB and those dying is it doesn't happen in the Western world. In America, less than 200,000 cases a year, right? And so that the 30 highest countries account for 87% of new cases, right? In those countries, China, Indonesia, the Philippines, Pakistan, Nigeria, Bangladesh, South Africa. Well, who cares about them, right? Because how is tuberculosis transmitted? But it's transmitted, from person to person through air. When people with lung TB cough, sneeze, or spit, right? Are there mass quarantine programs and mask wearing protocols all over this area of the world? And because like in China and stuff, they've been wearing masks for a long time, and in Japan and stuff, I mean, maybe it's really not helping them so much with TB after all, right? But it's just amazing that, if one life is too many, then what about all these tuberculosis lives? 1.5 million a year. Is the COVID number going to get that high? The reporting is so wonky. There's so much ample evidence. And that's one thing they don't want you to do. And that's why, I went right, watching The Watchmen and fact-checking the fact-checkers on this one. Because they don't want people to be thinking independently and doing their own research and coming to their own conclusions. All right, so I'm going to close this one out here. Remember, just because you don't know the truth doesn't mean you can't enjoy the lie. Right? And so until the next one, cheers, guys. Okay, so I got so excited there that I forgot about fact-checking the fact-checkers, right, and going over their sources. Because there were a couple of sources listed that were not directly quoted in the article. But there were some that were that I didn't get to touch on too, which of course was PolitiFact itself. So I wanted to find, PolitiFact was the Poynter Institute, right? All right, so what does it tell us about the Poynter Institute? It's a global leader in journalism, right? But to skip ahead a bit, to do some deeper digging, I found this from the Bill and Melinda Gates Foundation. And what is it? It's a grant. To who? To the Poynter Institute for Media Studies for $382,997. Right? So I kind of think there might maybe be a slight conflict of interest. Perhaps maybe if Poynter Institute is getting money from the Bill and Melinda Gates Foundation and they're using their PolitiFact arm to fact check themselves there. I don't know. I'm not exactly sure what all that means. But they also use the Associated Press. Now, do we really need to talk about the Associated Press? It's this massive media conglomerate. It essentially is mainstream media. Right? For at least a big chunk of it anyway, right? They have revenue of $368 million in 2015. Revenue, right? That's all. That's gross income, right? But their net income was only $1.6 million. Are you kidding me that their overhead and costs were $567 million? I cannot believe that at all. Not to mention that the president of the board of directors also serves as the president and board of Hearst Communications, right? And we know all about William Randolph Hearst, right? And no need to go into all of that, right? And then the last source that they used, which they didn't quote, I don't think, directly in the article, was this Daily Herald. And so I looked into the Daily Herald real quick, right? And it turns out it's this suburban Chicago, either newspaper, webpage, or whatever. And when I looked it up, and it really kind of presents itself as like an independent newspaper, right? And so, of course, I'm thinking that there is no independent, especially after the Associated Press, right? And so when I looked it up, I found out that they were published by this Paddock Publications. And so when I looked up Paddock Publications, right, the Paddock family, the paper started in 1871. Look at those eights. 88 right there. And was independently owned and run for 4 generations. And so when I went looking further a little bit, I found that the family had just sold it. It sold the paper to its employees on September 13th, 2018. I can't remember if that was a Friday the 13th, but I like to believe that it was. Right? And so when it was in here that I found the Paddock heir who was running the paper, right? And that was this Robert Y. Paddock Jr. And here he is. And now, because there's one thing I want to point out about him, I couldn't really find out what I was hoping to find. I was trying to tie him politically. I was trying to tie him, major publication conglomerates, and I really couldn't do that. But, I did tie the Paddock family to something really amazing, right? And so I want to start with this jawline here, this jawline right here, right? Because when I was researching the Paddock family, although I couldn't find that much other than the newspaper aspect I found this guy, Dr. Alfred H. Paddock, and who is Dr. Alfred H. Paddock? But a distinguished member of the Psychological Operations Regiment. Are you kidding me? Right? The first honorary colonel of the PSYOP Regiment from 1998 to 2002. Right? In the 80s, where does it say? Or in the 70s, rather, he was instructor in strategic studies. Look at the places that he served and was instructor at. During the 80s, he commanded the 4th Psychological Operations Group after commanding the 6th Psychological Operations Battalion out of Fort Bragg. He had special PSYOPs all over the world, including on U.S. soil. Unbelievable. Look at his decorations. All right, and then look at his banner here. Persuade, change, influence. Colonel Alfred H. Paddock. Right? Look at that jawline. Right? That is the same jaw. All right? I think it is. Right? Maybe I'm hallucinating and making my apophonetic connections go wild, but I cannot believe it's a coincidence either way if that isn't like the same genetic jawline, that the name alone, Paddock Publications, and this guy here aren't connected in some way, shape, or form. And so another source, that PolitiFact, I have to hold in suspect. It's unbelievable. All right. Until the next one. Cheers, guys.